Hi, everybody. I'm Michael Carisse, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. We've learned quite a bit on the podcast about the growing trend of providing medical care in the home, particularly as it relates to services enabled by advances in remote monitoring technologies. Well, today we're going to add to that base of knowledge by focusing on what's happening with in-home physical therapy services. Our guide will be Palak Shah, the co-founder and head of clinical services at Luna. That's a leading provider of in-home physical therapy that has helped 70,000 patients in 28 states since its founding in 2019. Ms. Shah has spent over 15 years as a physical therapist herself and is a board-certified orthopedic specialist. And thank you so much for being with us today.
Thank you for welcoming me, Michael. Appreciate the opportunity and looking forward to this conversation.
So we always like to start with a little career journey and understand the background of our guests. So what got you interested in healthcare, particularly physical therapy?
Great question. I think it's innate, right? Being in healthcare is about how much you care and how you care for your people around you, people that you work with, and people that, you professionally care for. So I believe that healthcare was innately in me as growing up, and I enjoyed pursuing the path. I did my education in India, and it was a pretty interesting journey getting into healthcare in India. And I think that might be a story for another day, Michael. But physical therapy, particularly, I find it very rewarding because you really have a very long journey that you spend with your patients to see them from being in a lot of pain and a lot of disability or functional limitation to really being able to get back to their function. And I think that's been the most rewarding thing for me in my career as a physical therapist. And while I am in a co-founding role, I feel patient care never leaves me because at the end of the day, you're building a platform that takes care of your patients. So yeah, I think that's the journey. It's about being curious. It's about caring and not letting innovation fall behind.
So I have to ask about what was interesting about the experience of training in healthcare in India.
Ooh, I think my biggest asset of being trained in India was the academic rigor. I think my school was academically very rigorous. It was a teaching institute. So we actually had access to a lot of patient care similar to, the United States. And with the academic rigor comes the ability to be developing grit and resilience and, not losing your path. And so I believe that it taught me the soft skills and the competitive environment. So I think it's a combination of the academic rigor and the environment that really helps you pursue your path, your passion. The other really interesting thing is how you actually get into physical therapy. And I don't know if, enough of the audience might know this, but you actually get graded, you're ranked, what's your score? And then you kind of choose the profession based on your scoring. So it was very unique. It's not only what you're interested in, it's also about your scores. So yes, I think it was, unique in a way. I had an option to go into dentistry or physical therapy. And I said, I think I'm going to take physical therapy. So it's interesting. But at the same time, I think what's unique is about how you know yourself as a professional and what you want to do in your profession. So I think, as I mentioned, caring and innovating were two things. And I think the fact that my parents had received physical therapy and I saw them get better, sometimes not get better, really made me curious as to how do I make sure all my patients get better, That was, I would say, the unique thing about India and doing my education in India. Once I got here, I got licensed. I got myself into orthopedic certification, specialization, and my experience working at Stanford, I believe, has been the most game-changing one for me, bringing evidence-based care, bringing exceptional patient experience, working with world-renowned, surgeons and physicians, but at the same time, a fantastic group of colleagues who always keep you up to date with, what you're bringing to the table. It's all part of your journey to bring excellence, right? And you want to be someone who wants to keep learning, and those were great environments for me to thrive and learn. So yeah, I think it's what makes you what you are today, right?
Absolutely, yeah. Well, in academic settings, as you're aware, do provide that extra range of subspecialty experience and all the bells and whistles and the expertise on staff. So you can see how that would kind of strengthen what you're able to offer patients.
I was also going to say the underprivileged areas, right? So my experience in India also helped me understand how to deliver great care, even when you are not in the most privileged areas of the world. I think that brings something to you as a person as well.
Yep. You got to make do, right? Figure it out. So there you are. You're having a successful PT career and you shift to this entrepreneurial path. Usually when we talk entrepreneurs, it's because they have identified a problem and they think they've got a solution. Is that what happened in your case?
Yes, as I would say, at my journey during my journey at Stanford, definitely identifying what we can bring to the table, right? Excellence. How do you bring excellence to your patients? And then you run into limitations. And when that happened, I was on the path of identifying, okay, maybe I need to start my own practice and my own clinic. And when I met the founder of Luna, I was really excited because the opportunity that lied in front of me was, do you want to have 16 therapists in your private clinic and open more clinics, or do you want to join this mission and vision to bring this excellence at scale to the 50,000 therapists in the country? I definitely had an easy win there to say, I definitely want to be a part of the platform that allows that scale, allows that standardization and filling in the gaps. So I think, yes, it's about connecting yourself with leaders who have similar vision and are all on the path to bringing that impact. So it's definitely never one person's vision or mission, as rightly know. So I think finding that amazing co-founding team was, I think, the biggest win and the decision maker for me to, make the switch.
And what have you guys created? What's the overview of Luna?
Yeah. You know what? The most unique thing about Luna is, as you mentioned, we are in physical therapy. It's the one of the least talked about specialties, if I will. But at the same time, the latest, healthcare conversations in the MSK world have spoken so much about the contributions that physical therapy make as first line treatment providers in terms of value-based care, in terms of cost savings, in terms of patient experience. And our journey started in a really good time because when we started in 2018, 2019, that's when care at home started becoming so much of a conversation. While, we started before COVID and we saw during COVID that our patients loved the opportunity to receive care in the safety of their home. Our ability to really dispatch care at home is truly not one of the easy things to do, right? So physical therapy in the home is hard to deliver. We stayed focused on that. We tried not while moving into telehealth was something a lot of practices were able to do. We made a choice that if they wanted it, sure, but we made a choice to continue to perfect our in-home care service delivery offering. And how do we do that at scale was our technology. It was the product that we have built in terms of care coordination, pathways that we have built. How do we bring therapist performance monitoring and support to our clinicians? So I think that was the most connecting thing for me, Michael, which was Luna really thought about how do we leverage technology to make it the best platform for therapists, for patients, and for our physicians and partners that work with us. And I believe most organizations might think they're delivering patient-centered care. And what really connected with me was how much we are thinking about our clinicians, how much we're thinking about the physicians and the partners that are working with us, and how we're building technology to support that ecosystem. So I think that was, I would say, what Luna does really well is it's leveraging technology not to deliver the care, but to really enable and empower the clinicians.
Well, speaking of the clinicians, from their standpoint, their perspective, how does this work? How do they get connected to Luna? What's the process like? What sort of requirements are there to be part of the Luna platform?
Yeah. So I think the most unique thing about what we're doing is when you go to a clinic and you have, 20 therapists, 25 therapists, you're limited with the specialties that they bring in. right, in terms of treatment. Physical therapy, there's lots of specialties. For the audience that might not know much about PT, we are specialists. There are specialists in orthopedics and sports physical therapy, specialists in neurology physical therapy, vestibular care, pelvic floor and rehab. So there's specialists, board certified specializations in these different specialties. So Luna actually supports all of these specialties. When we bring our therapists on board, we identify if you have experience working in orthopedics or neurology or vestibular care. And when a patient calls in, we have a screening that identifies if the patient needs what specialty of care. And we match our patients with our therapists based on specialty, geographical coverage, and all of that, so that we can find the best PT for the patient. So keeping that in mind, when we bring therapists on board, we have a dedicated therapist acquisition team that connects with PTs, communicates how this platform is really built for them and how this brings them flexibility, independence, and truly addressing the burden that we all talk about, but we don't necessarily have very many avenues of reducing that. So how does Luna support reducing burden for physical therapists, gives them a flexible environment? And one example of that, Michael, is an average physical therapist makes about 85,000 a year. And by doing 10 extra visits as supplemental visits with Luna can gain them another extra 35,000 every year. That's a significant opportunity for physical therapists. So thinking about who really connects with that vision, who needs that flexibility, and we've seen immense response. We have now over 3,000 physical therapists on the platform.
And are any of them doing this as a full-time thing, or it's mostly fitting it in around their other schedule?
Yeah, so 90% plus of our physical therapists do it as moonlighting, and hence the name Luna, right?
Okay.
So yes, most of our therapists do this out around their full-time jobs or work because they want flexibility in their lives. They may be new parents. They may be working for certifications and specializations. They might be in fellowships and residency programs where they are learning and developing their skills, but not making enough income. So I think we're seeing such amazing opportunity where this flexibility and convenience has helped clinicians be a part of this platform. But also from a requirement standpoint, today Luna only treats with licensed physical therapists. So we don't have physical therapy assistants on the platform today. And I think a 45 to 55-minute one-on-one session with a licensed clinician is what we offer, right? And these therapists are 3+ years of work experience. So we try not having therapists who might struggle in an independent home-based environment. We want clinicians that are experienced, 3+ years in the area of expertise, and that's how we match them with our patients.
And the app, as I was reading up on it, so it just makes it simple for your therapist in terms of scheduling and billing and payment and all that sort of thing, right?
Yes, but at the same time, all the patient care related things, documentation, assigning exercises, chatting with your patient, all of that happens within the Luna app. So our goal was not to have a therapist need 15 days of EMR training. How do you
Right.
how do you enable clinicians to do a moonlighting kind of an opportunity with a very, very easy app that is secure, that is easy to learn, that's intuitive, and saves you a ton of time. So, Michael, one of the really exciting accomplishments of Luna is we call this feature the auto charting, and everybody in the medical field, ironically, but I mean, as a joke, loves documentation, right? It's the
Despite what people may have heard, it has nothing to do with burnout, right?
Not at all. Exactly. That's the favorite part of our jobs. So I have to say, my time at Stanford, pretty challenging, right? We are seeing 15, 16 patients in a day, 30 minutes, back to backs. Our lunch hours are documenting. It's really hard to keep up. We want to do a great job at patient care, and anything that can help us do that is really game changing for us. So we built this feature called auto charting, where a therapist usually dictates, but at the same time, their chart's ready, and also does a compliance screen. So if anything's missing, our therapists get a quick notification even before they sign off on the charts. So it's really enabling this real time documentation solution that we've built for our clinicians. And we did an analysis last year where we said, therapists have saved enough time to go to Mars and come back. That's how much time we've saved as a whole.
Not the moon?
Body charting. Not the moon just yet.
Okay. Yeah, well, you can see how that would be very attractive, to folks as far as getting involved with you guys. Now, so from a patient perspective, I'm out there, I need physical therapy services. How do I find Luna and how does Luna work for the patient?
So the best thing about Luna is that it's covered by insurance. When we started, even before the transparency rule was implemented, we have a very clear payment model, which is if you're a self-pay patient, it's $125 a visit across the country. It's simple. It's on our website. It's very clear. And if you have insurance, most PPOs and Medicare patients are covered by Luna. And we are the same copayment that they would have to go to a clinic to come to Luna. So we want to keep it very simple for our patients. It's concierge-like service, but with no added cost. So when patients call Luna, we identify what insurance do you have, if we're in network with them. And if we are, we match them with our clinician. So we want to keep it as simple as possible to provide access to our patients.
Some people might think about doing PT of certain types in somebody's home. People can live in tiny little apartments. You won't be bringing in gym equipment. Talk about the actual delivery of services, what obstacles there are, and how you folks have figured out how to work around those.
Yeah, great question. So what's exciting is the definition of physical therapy has changed to being movement experts in the last decade. So physical therapy as a profession is focused on less use of equipment and passive treatment modalities as compared to active approach to care. And you can do that best when you are in your natural environment. So bringing physical therapy in the home actually cuts down 20 minutes of questioning that we do with our patients in our evaluation. Do you have stairs in the home? How much space do you have? What equipment do you have? There's none of those questions when you have the opportunity to be in your patient's home. So I think physical therapists are super grateful for the opportunity to be in a patient's home. You know their home environment, you know their lifestyles, you know what equipment they have, what surfaces can be challenging for them, and you can tailor the program to their home environment. So when we did our analysis on patient population with the health system in Southern California to identify what percent population can be seen in the home, we came to a conclusion that 87% of the population that's seen in the clinic can be seen in the home.
Wow.
And that's because most of our patients don't need heavy machinery or equipment to do physical therapy. In fact, a sustainable program of PT is a lot more effective than something where there is dependency on modality.
Mm-hmm.
So if the other 13%, if the patient is not safe in a home environment and needs special equipment in the clinic, needs more clinicians to be around, needs an aide, an assistant, in those times are when we don't want to see our patients in the home. So we can prepare them in the clinic and then have them continue independently in the home. So for that 87% of the population, they appreciate this so much because there are so many hurdles to access, maybe time constraints, ability to come to a clinic, the cost of travel, the dependency on family and caregivers, none of that. And bringing the care in the home really helps tailor the program to their home environment. So
it's huge for the patients. I forgot to ask you, do you need to be homebound or have limits on transportation or any of that stuff to take advantage of this, or is it open to anybody?
Currently, at Luna, it's open to everybody. So we are, even if you're not homebound, I think being homebound is not a requirement to be seen by Luna. And, the most important thing is how you're delivering skilled and medically necessary care to your patient.
In just a few years, you've served 70,000 patients. I think I saw that you passed your 1 millionth visit mark
Yes.
recently. I'm wondering what you folks have learned from all of those encounters in terms of patient outcomes.
we've learned so many things. So thank you for specifying regarding patient outcomes, right? So I think one really important thing was focus. I think our having our focus on where we want to drive impact was really critical. So access has always been something that we really focused on from the get-go. How do we make access to care better? So while patients, current average of seeing a patient in the clinic is about 21 days, average days. Luna sees patients within 48 hours to 72 hours of needing care, and that access was a very critical focus for Luna. In terms of patient outcomes, I think having a clinician's lens in building the platform from the get-go was very, very critical. Because we have our own technology in-house, we've built an integrated technology solution where, from collecting outcomes to delivering care and completing documentation, to assigning them exercises, to our pathways, all of that's been built in-house. So it feels very integrated, where you don't have to have logins and passwords. Patients don't have to go to different platforms, receive emails and text messages from different platforms. So having that integrated platform has really been enabling us to have very high patient engagement, even on our technology solution. Even if we have our patient app, patients don't have to have the Luna app. And all of that, I think I look at outcomes from engagement perspective along with clinical outcomes and patient satisfaction. So for me, outcomes mean all those three. And I think we see some really great results out of what we have been delivering for our 1 million visits. And to call a few, Luna has been participating voluntarily in the MIPS program for the last 3 years, and we've been in the exceptional performance category. So we measure standardized outcomes, we submit them to Medicare, and we are open to benchmarking ourselves across the industry, and we've done phenomenal. We got a perfect score last year. So
Wow.
I think our goal is to standardize how healthcare outcomes are measured and benchmarked. I think that's very critical, and I think we've done really well. Luna also measures NPS scores. So our NPS today is 87, and
Can you tell
that's
people what NPS means?
Net Promoter Score. So it's a loyalty score from your patients, like how likely are you to recommend Luna to your family and friends. And I think that's one of the biggest trusts that a patient can have in an organization, right? So
Sure.
I think we hold that very highly. Luna's NPS score is 87, which is considered world class. It's like
Yeah.
an Apple or Airbnb, right? And it's really hard to sustain that over the 6 years journey that Luna has had. So we feel really proud about listening to our patients, their needs, and creating a supportive environment for them to receive the care. The other aspect from an outcome standpoint, Michael, is our returning patients. It was really exciting to see 30% of our patients actually come back for receiving care with us. And that means a lot to us because that helps us understand that we are providing care that can help them along the way in their recovery journeys, not just for that episode of care, but for other things that physical therapy can be helping them with. So, keeping our patients functional and being part of their functional recovery is a great outcome to strive for.
Sure. I do want to ask you about the business side of things a little bit more. So you partner with health systems and orthopedic groups. What's your pitch to them? I mean, what are the benefits to those business partners in getting engaged with Luna?
Yeah, great question. And really excited to share that Luna is partners with more than 50 orthopedic clinics or health systems today. And one of the biggest reasons why is because those organizations and health systems have years of work that have put into their excellence. And Luna really wants to support their journey to expand the reach of their patients. So, especially with physical therapists, right? Patients will travel far and wide to see a physician, a surgeon, get their surgery. But it's really hard to keep up with 1 to 2 times a week for 6 weeks of physical therapy traveling back. So those patients actually get lost and don't come back to the health system. And we've shared a lot of number of blogs and white papers on the referral leakage in health systems. And what really that enables us to do is enable a service line for the health systems. For example, Emory Physical Therapy at Home, powered by Luna. So what we're doing is helping health systems identify their referral leakage or their service offering and enable the outpatient physical therapy in the home offering for the health system.
Oh, that makes perfect sense. We're almost out of time. I want to give you the same chance we give all our guests to leave with some advice. We have a lot of students and early healthcare professionals in the audience. You obviously went through that whole experience of picking a career and establishing yourself. What's your advice to folks who are entering the healthcare world right now?
I would say that, we all want to bring about change, but doing and really executing on some of your ideas and doing that at whatever scale you're contributing as a clinician, as a manager, as a regional person. I think there is an opportunity that we can bring change where we are that really helps people see what we're trying to say. And I think that execution focus is one of the most important things. So execution, I would say, if you have an idea, try to figure it out and execute in whatever way and wherever you are, and the world will see what you have to offer.
Yeah, that's great advice and a good spot to close on. I want to thank you so much, Palak, for being with us today.
Well, thank you for having me, Michael.
I'm Michael Carisse. Thanks for checking out today's show. And as always, remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.